I just love the culture here. The people here just feel like a second family. You really get to know your co-residents really well. We're a more tight-knit group of people. And then you spend so much one-on-one time with all of the faculty that they get to know you really personally too. And the people here just, you could tell they like genuinely cared about you becoming the best radiologist you could be, but also having success in your personal life. And that really came across to me, and it mattered a lot to me while I was in training. So that was one of the biggest reasons I wanted to stay.
You do the first year in internal medicine here at SIU. We're affiliated with 2 hospitals, and then you go right into your 4 years of radiology, and that's also split between 2 hospitals. So we'll rotate at Memorial Medical Center and at St. John's Hospital. So I think that's a big strength of the program because you get exposure to different hospitals and different hospital settings, and both of them have different strengths. So you pick up different things at each hospital.
SIU is very unique, and I kind of think of it as the best of both worlds because you have this program and it's run by 2 of the largest and most successful private radiology practices in the country. And they both come together and work together to volunteer to run a residency program. And they've been doing it for decades, and they do it with a great amount of success. So you really get the best of what a private practice atmosphere could be like. But then also you get to work at 2 hospitals that have about 500 beds each. They're both level 1 trauma centers. They've got comprehensive heart and stroke care and PICU, NICU, high level maternity care. So you get prepared to be successful no matter what job you want to pursue afterwards. I really love what I do, and I feel like there's so many facets of radiology that you can pick from. I really think anybody who becomes a physician could probably be very happy as a radiologist because I think there's a subspecialty for anyone. If you're working in a clinic, you might see 10 or 20 patients, but in radiology, you could read 100 cases. So just having that impact and feeling like what you were contributing was really valuable to every patient's care.
There's always something to do in Springfield. There's lots of festivals downtown when it's warm, lots to do, lots of restaurants, little microbreweries. So we can always find something to do.
Springfield is like the best aspects of being in a big city, but without the stress and the chaos of being in a big city. Anything that you could want to do, there's theater, there's arts and fairs and entertainment and events, and there's hiking and boating and all sorts of things that you could do, but also without the stress of the traffic and the cost of living and just busyness.
It's very easy to live here, it's very cheap to live here, and so you get some of the benefits of being in a big city, but it's a lot cheaper, it's a lot easier to live here. And we're close to St. Louis, we're close to Chicago. If you need to get to a bigger airport or go shopping for a weekend, it's easy to do that.
There's just such a sense of camaraderie. People want to celebrate your successes with you and also be there for you when you're going through something more difficult. If you get stuck on a case, you can always ask any of your colleagues to come look at it too and get a second set of eyes. So it's just a very collaborative and supportive atmosphere.
It's a good place to do residency because there are a lot of attendings. Someone's always available to work with. There's no fellows, there's very few residents. You work directly with attendings virtually in every rotation. You're working directly with the experts in their field. You get a lot of hands-on coaching.
I think one of the biggest testaments to the culture of this program is how many of our residents come here and choose to stay and pursue their careers here. And I think that just speaks a lot.